And therefore, I would like to invite Emily Masharia from Kepler, who is going to talk to us about being one of the actors that has promoted and popularized hospice care in Kenya, palliative care in Kenya, including policy formulation, but at the same time brings the face of survivorship to the forefront to ensure that we can reduce stigma, ensure that we can enlighten Kenyans on what they need to know, where they can get the services. Emily, take the mic. Thank you.
Thank you so much, Brenda. With all protocols observed, good afternoon. My name is Emily Masharia, and I work with Kenya Hospices and Palliative Care Association, and we are the association that coordinates palliative care in the country. So far, we have 104 units offering palliative care in the country, and that includes hospices and also palliative care units in Kenya. In KNH, I want to say that we have a palliative care unit led by Dr. Esther Nafula and a big team. So you can access those services. Going to talk about stigma, as Brenda has asked. The first thing is that there is a misconception that says palliative care huyu anaenda kukufa, right? And that is a lie from the devil, I would say that, and it's a biggest scam. Palliative care should begin from diagnosis. The time you're told that you have a life-threatening condition, cancer is among them, and many other diseases, should be the time that you ask for these services. And WHO and other recommendations, including we have a national palliative care policy 2021 to 2030. They recommend that as you start curative, you know, the dawa, chemotherapy, radiotherapy, you should be going hand in hand in palliative care. Palliative care, we offer quality of life, looking at 4 dimensions. We look at your physical pain, we look at your psychological pain, we look at your social pain, we also look at your spiritual pain. Because these are the things, I know you're given painkillers to cure your pain, but then again, what about your family? What about your finances and many other things? So I would want to say that palliative care starts from diagnosis, and it's been a growing journey. We are not yet there. We are looking forward, even as an organization, as we are doing advocacy in the county level, in the national government level. We are looking at enhancing integration of palliative care into our facilities. So far, I know we have so many facilities in the country, but then again, 104 is somewhere that we have reached. Looking forward to all of our facilities integrating palliative care. Again, I want to say that we as the community, we as the survivors, we have a role to play. We say that palliative care is everyone's business. So ensuring that the person next to you, who you know is going through a tough season, accesses quality of care. Even as a community, you give them a good place to live in. You ensure that they are comfortable. We will all ensure that, one, we do not stigmatize cancer or any other illness, as well as we make them, their caregivers, their families, be at a better place. Thank you.
Thank you, Emily. And one thing that Emily didn't mention is financial pain as well. Cancer comes with a lot of financial pain, and often that is one other area that leads families to actually desert, leads community to move away because they are afraid of what it is going to cost, isn't it? And therefore, when we think about that, we also need to address some of the risk factors that affect us in cancer. Because if we educate our community about prevention, if we educate our community about making sure that they can address cancer as early as possible, we'll be better able to manage the cost of cancer. Correct? And therefore, with great delight, I want to invite 2 parties to the podium. We will start with Joel Gitari. He is with KETCA, and he'll tell us more about KETCA. But what I know about Joel is his advocacy skills. They are top-notch. Because he has, together with his team in KETCA, managed to ensure that we have an act, and we also have a policy that is being implemented on tobacco control. Joel, take the podium.
Good afternoon. Yeah, I'm happy to be here together with the heroes. You are very, very important people, very close to my heart. Mama here is not just my Kisumu for Kisumu. She's beyond Kisumu and even beyond Kenya. We hold her very highly for the work that she's doing. I want to thank Kenko for the opportunity that we have, not just here but in Kenya, to do whatever we are doing. Many a time I've told them that they are a gift to this country from God. The work that they are doing, and I remember my brother David, when we were talking, and we talked and I said, surely, if I'm the chairman of KETCA, and we are talking about cancer being caused by tobacco, and yet we are not even close to Kenko, then we must be jokers. So I decided that we must be part of Kenko, and we've had a very good time together. Personally, I've learned quite a lot, and they have so many programs that I listen to on online. So many of them. I like anything to do with the cancer. I must be there when I have the opportunity to do so. So I thank Kenko for those programs, because they are making some of us who are engaged in preventive areas to actually get the skills, to get the knowledge, so that we are part of the fight. We make informed decisions and we give people facts basing on the information that we have, so that we don't just stand before people and say tobacco causes cancer and then we stop there. We are able to explain more. I remember my dad suffered from leukemia until he died, and I was very ignorant. I didn't even understand really. I remember people saying that some things were sucking his blood, but majini yananyonya damu. So we couldn't really understand what that was. And a colleague at my place of work also lost a kid of about 5 years to the same. And this time I knew something about it and I was very close. So as we continue actually talking about this, we are stressing the issue of prevention. Prevention is better than cure. That is where we are. That's some of you who are here will agree with me that had something been done in your life earlier, maybe you couldn't be where you are. Maybe it's because you were involved in smoking or drinking or doing things that led to where you are now, or somebody close to you did it, maybe because of lack of information. So I pray that we all look for this information, so that as we live, we continue even encouraging others. And as we have said, you as survivors, you are resource persons wherever you are. You are demystifying cancer in the community, because people have always looked at it differently. They have given it different names. But when you are there now, you are able to show people where they are supposed to be. So everyone is involved, as we have heard, that wherever we are, we must do something about this. We must continue educating the community. And that's why I have also personally taken upon myself that task. I go through schools. I'm a teacher. I'm a deputy principal in one of our high schools. But because my profile was very brief, I am the winner of the Global Tobacco Control Award 2022. Because of the things that we do, just as it was said, somebody outside the field of medicine was awarded, I was also awarded, and I'm not a medic. So we can do these things together. When it comes to those policy makers, we must push them so that they come up with the policies that work, and then we ensure that implementation is done. and we are part of that. We try to force those who are there to implement and to enforce the policies that we have. Because Kenya has got very good laws, as we say, but they are for the shelves. They are not for implementation. That's why we keep on suffering like this. But we need policies. When you look at even the finance bill that we are talking about now, we ask ourselves, how is it addressing the issue of cancer and other NCDs? Where are we? Is it going to help us? And I'm happy when I look at Kenko and others, the way they are fighting, the way you people are doing things. Very wonderful, because you put the government on its toes, and we are there with you. We shall continue to say prevention is better than cure, to glorify God for those that are victorious, as we even continue to say we want this number to continue going down. And asking the industry that if it has got human beings, the tobacco industry, to do things that are in line with what human beings are supposed to do. Coming up with products that kill people, that bring us all these sufferings, is something bad. And that is where we are now, with so many inventions, some of the things that they are terming as safer alternatives. But when researchers tell us that these things are harmful, other fake researchers also emerge and say they are the right things to use. So let us hold hands together and say, now that we have survived, we want to make even more and more people to survive, and we hold hands together with even those who are not survivors, because they have got family members who have gone through this or who are going through this. I've been talking to my brother, we say Uncle Zach, and saying that 98% of those who we are seeing here survivors are ladies. Does it mean that men are not going through this? They are there, but then some are shy, they don't want to say, they are hiding. Men are very difficult, They are hiding, But now, that is another level. Let us try to help these men also. Help us to come out of this so that we do not continue hiding as we suffer until things that could have been managed just to take us away from this world. There is one who I've been helping, I've been working through this week, and I expected him to be here, and surely he is not here. Yeah, you see. So help us. I think I'll not say more than that, but we are together, the Kenya Tobacco Control Alliance. Nowadays we have changed the name a bit to Tobacco Control and Health Promotion Alliance, because we are addressing wider areas of health, and we really focus on especially these drugs that interfere with our lives, that cut short our lives and give us sufferings. They put us into unnecessary expenses, and that is why we say that we are part of this team, we are part of the survivors, we are part of the army that is fighting against cancer. Thank you, and God bless you.
Thank you so much. Yet another award-winning advocate. Hey, advocacy. Situjichoche kiasi pia. Sivyo? Aya, thank you so much, Joel. And Joel talked about two things that stood out for me. The first one is the myths and misconceptions that are in the community. And the second one, so mtu ananyonywa damu ndio sababu ana aga juu ya cancer. Those are things that we need to stop in the community. But the other thing that stood out for me was the tobacco industry and how it is targeting even our youth with innovative marketing. To be able to bring products that are now said to be safer, to be better, to be more hip. Believe it or not, some of us would have fallen into that if we were younger. It's just that. Because it is so good marketing. And therefore now we have to stop them. And the way to stop them is to actually bring more action on advocacy, more passionate advocates like Gitari who are able to bring that light to the community that we need to stop tobacco industry. As we do so, we have another advocate, And this time she's actually an advocate of the High Court. Yes, sio kama sisi sitasema kitu. But advocate of the High Court, she's also the National Director of the National Taxpayers Association of Kenya. She is here because we know, often we say cancer treatment is expensive. And it is. Often we say there is no money for funding cancer work in Kenya. And true, because we'll be hearing from policy as well, sometimes that money is also somewhere else that could be appropriated and allocated to cancer control. So Anne, as we invite you, Irene, as we invite you to the podium, I would like for you to just touch on what is NTA, what are you doing to ensure that the laws that have been set together with KETCA, for example, that have now become a law in Kenya, can be able to also serve Kenyans in cancer control. Need I remind all of us that today is World No Tobacco Day, and therefore we are also commemorating that by inviting our partners to be able to speak. Anne, over to the podium. Thank you. Irene, thank you.
Good afternoon, everyone. Hamjambo. My name is Irene Otieno, as has been stated. I'm the Executive Director at National Taxpayers Association. I know all Kenyans seated here when we hear tax, na tunajua tunashinda tukisema zakayo, so let me not get on the wrong side of the politics. But as an institution, I'll just take a few minutes to explain as has been asked. So National Taxpayers Association is an organization that was established that in acknowledgement of the fact that our government seeks to increase taxes of everyone. But when you look at provision of essential public services, that has continued to decline, or our government has gone to what we call public-private partnerships. If you looked at the road that we have, the express, you pay to use it, isn't it? They are saying they're reducing how much they'll be paying for higher education, and if you look at how much they are giving per child in terms of free primary education and compare that with the allowances for foreign travel and domestic travel, you see we have a problem. So our institution seeks to work, particularly at the county level, with what we do is to develop scorecards with communities, look at the Auditor General reports. I don't know how many have looked at the Auditor General report for their counties, and then use that to hold your local leaders to account. So that is the accountability side. However, for purposes of today, we are here as friends of KENCO, because with the support from Bill and Melinda Gates Foundation, together with Tax Justice Network, we have been working on a project that seeks to advocate for increased taxes on tobacco. So as a country, we know we do not want more taxes, but we feel that that blanket conversation around taxation makes us lose on very significant areas such as tobacco and new generation products. If you look at how our country taxes tobacco, we already have a law, the Tobacco Control Act of 2007 and the regulations, and we have also signed at the international level to the WHO, FCTC, that says that the price of tobacco products should be 70% of it should be taxes. But our government has not done that, in spite of the fact that they've said that cancer is a problem in the country. So we have seen our government every time we make submissions to Parliament, and I'd want to inform us as players here that for the first time last year we did not have any tax on tobacco or new generation products. That is in spite of the fact that we have seen different marketing strategies, and now they are targeting the youth with the emerging products, the nicotine pouches and the e-cigarettes, which have been said from research are more addictive. But our government, from last year when we made submissions to Parliament, they asked us, we need to improve employment and we need to invite investors. My question sitting here and hearing the survivor stories, I do not think we can put industry ahead of people. And so for me, that I find very problematic. And the government needs to decide which industry do we want to promote. An industry can evolve. You can close one industry and people will find another industry. But we cannot find another Kenyan when they are hurt and when they are suffering from diseases. So one is to mention that the politics of the day and the industry seem to be one. And we feel that as civil society players, the reason I've come here today is I have looked, and it is good kuangalia ndani, sindio? I have looked at our advocacy over the years, and the success rate, it has not been as effective in terms of taxing tobacco. But sitting here, I feel if Uncle Zach and the survivors make submission before Parliament, that will be more compelling than civil society organizations. So I'm hoping that this afternoon, as my colleague Ketka and the rest of us members of Ketka have an appointment with the Parliament, because they are reviewing the current tax rates for tobacco in the afternoon at 3, we will have some of the survivors join us and make us see that this is not, so we can move and tell government, easy stories are jaba. Tunasemanga hivyo. There are people that are living these experiences. And to the government counterparts that are here, I was very excited to see that we have National Cancer Institute, Ministry of Health. And before we came, we looked at the strategic documents for NCI and MOH. And we were very excited to find that they have those 2 clauses saying that they want to tax. So they acknowledge tobacco is a key factor on NCDs. They want to tax it to 70%. So my take here is the strategy runs to 2027. We are midway. And we are here to say we want to support you to realize it, because we also understand that government to government interagency conversation is more compelling also than us as CSOs. So I look forward to some of those submissions not being made by civil society organization, but government as NCI, MOH, going before the Molo Member of Parliament and asking him, why are you not taxing this product that is killing Kenyans? And as I bring it to a close, noting that we have Excellency seated here, we have been trying to speak with the Council of Governors, because we know that health is a devolved function. We do not understand why the counties perennially say they are underfunded, but they let government forgo revenue from tobacco industry. So it would also be good to see His Excellency Njuki as the chair of the Health Committee making those submissions and not civil society organizations. So my plea also to you, Excellency, is if you could help us on that front. How do we ensure that we ensure this efficiency of health funds? Because if you allocate 10 shillings to the health sector and tobacco erodes 7 of it in terms of treatment, we are moving backwards. So we are seeking allocations for health, increased healthcare, but we are not looking at the things that erode the efficiency of what is already there, and tobacco is one of them. Lastly, as we are all aware, government has been changing how they will finance health, and we have the chronic fund that is already under discussion. Our question again is, how many people are affected by cancer? Will that fund be enough to take care of those needs? We know treatment can move you from where you think you're middle class to poverty. And the people who don't have, what happens to them? But if we are saying that fund, if you hear our president, he said when he was telling us that we need to pay all of us that increased rate, he was leveraging on cancer as the reason why he wants that social funding. But the question then is, if we are sincere as a government and our president is sincere that we'll be putting a social health fund and the chronic fund, the first thing would be then to move tobacco taxation to the highest, to look at any other product that contributes to NCDs and cancer and tax it accordingly. So I'd want to leave it there, but to say that today I have really been encouraged by seeing the survivors, hearing the stories, and we are together in this work. Our way of addressing the cancer issue might be different. For us is the taxation and looking at oversight around health budgets. But the people who are really in the trenches doing this work, we would want to say thank you, and we will continue to support any player in this sector. Asanteni sana, and may we continue to have a fruitful deliberations.
Hey, have you heard? Have you heard? Yes. So if we want knowledge so that we can advocate with knowledge, that's the place to go, isn't it? Yes. Because then we'll have those hard-hitting facts. In fact, can we accompany you to Parliament this afternoon? Anyway, as we have been sitting for a very long time, and yet we also need to get our bodies moving. And because I can't do it as good as Njeri can, I would like to invite Njeri and Sydney to also invite Hope Wambui so that we get to hear a different voice of a youngster before we get to the next panel, which is speaking policy. Sawa?
Simama kidogo, tunyoroshe. Simama kidogo. Tunyoroshe. We want to see whether you listen to instructions. Sawa sawa. Are we good in listening? Okay, stretch your hands. Some people are not standing, so we are not good in instructions. Stretch. I call up, 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 up. Chini, 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 chini. Up, 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 up. Now listen. When I say Jerusalem, you bend. When I say Judea, when I say Joppa, sawa sawa, Jerusalem. Watu Jerusalem ni kuinama mami. Aha. Jerusalem, Joppa. Joppa is jumping. Watu hawaruki. Listen. Jerusalem, Joppa. Jerusalem, Judea, Judea, Joppa, Judea, Joppa, Jerusalem. Kuna watu hawaruki. You have to jump. Nimesema Jerusalem, inama. Judea, alafu Joppa. Haya, tuko pamoja. Haya, Jerusalem. Kuna watu wajainama huko nyuma. Watu wa Tobacco hawainami. Jerusalem. Hatutawapeleka mbuge. Judea, Joppa, Joppa. Joppa kila mtu. Joppa, Joppa, Joppa. Jerusalem. Jerusalem. Hamna migongo. Jerusalem inama nandi. Joppa. Joppa. Asante sana. At this juncture, please allow Hope Wamboi Otieno. Aka kamrembo kamekuja hapa. Kaeni chini. Wageni waheshimiwa kaeni chini. Today is your day. Huyu mrembo amekuja hapa na kuanzia asubuhi ako na presentation yetu ya kufanya. So Benda, if you don't mind, can we give just 2 presentations? Yes. So we have Hope Wamboi with the presentation, and we'll have Rachel Kariuki with the presentation. Haraka haraka. Thank you.
Hi everyone. Hi everyone. My name is Hope Wamboi Ochieng. I'm 13 years old from Peace Junior School. I am a poet using poetry to send messages of hope and create awareness. I was born on 4th of February, which is World Day of Cancer. I plant trees of hope to keep my poetry alive as a physical symbol. And today we are going to be planting and growing 12 trees, symbolizing the 12 months in a year, because we have so much hope that every month we have survivors. And my presentation for today is about No Hope is Lost. Welcome. No love is gone, for we still love you, and will always be there for you. No hope is lost, for we still have hope. There is hope. Itakuwa sawa. For when you choose hope, everything is possible. Hope is believing in yourself, trusting in God, being brave, bold, courageous enough to fight on and never give up. Recovery is a process. Even though it seems hard, long, slow, at times you feel you can't breathe and almost losing it all. Keep your hope alive, for tears endure for a night, but joy comes in the morning. Your Redeemer lives for you to face tomorrow. Let's create awareness, give hope to patients, celebrate survivors. There is hope. Itakuwa sawa. You are a warrior, and a hero lies in you. I, Hope Wamboi Ochieng, stands for the cancer survivors in my efforts to make this world a better place. I will, and I must join SDG 17 in partnership to support SDG 3 for good health and well-being. Hashtag no hope is lost. Have hope of light to see in the darkness, because soon a new dawn is coming for you to look back and say, I made it through. Thank you.
We are gracious to God. People are hungry. Are we gracious to God? Yes. So are we going to live with the resilient spirit that we have? Yes. Sawa sawa. Rachel Karaoke tafadhali kimbia hapa. Rachel, mimi ni mama wa matiti mmoja. Leo nimepata mama mwenye hana matiti. Nitakuwa ninatembea na yeye, tunafanya advocacy. Sawa sawa. Na tutaogopa ama tutaogopa? Hatutaogopa. Sawa.
Haba. Hamjambo nyote. Hamjambo tena. Kwa majina naitwa Rachel Karaoke. Mimi ni kansa patient. Wacha nijiite patient sababu bado naendelea na matibabu. Na nilipatikana na huu ugonjwa 2021. Ni generate sana. Nikafanya mambo zangu zote, chemotherapy, radiotherapy, na nikatolewa titi hii moja. Na kufikia 2023 kansa tena ikarudi kwa mwili na ikabidi nitolewe hii titi nyingine. Nashukuru Mungu kwa umbali amenitoa, kwa sababu hii safari ni ngumu sana, na pia najua kuna wengi kama mimi, lakini ni vigumu sana kujitokeza na kuweza kujionyesha vile mimi nimejionyesha. Nimefanya hivi kwa sababu kuna mtu pale ako nyumbani amejificha, ako na uoga, lakini akituona hapa mbele ama akituona tukiongea, unaona hata wengi wanajaribu kutukaribia na tunaweza kukua pamoja nao. Bwana asifiwe. Mimi hufanya shairi na mimi hutunga shairi zangu mimi mwenyewe najifanyia, alafu bado mimi huomba vile naweza nikapatana na President William Samoei Ruto tuweze kuongea na yeye about mambo ya kansa. Bwana asifiwe. Shairi langu linaenda hivi: si mimi peke yangu niliyetolewa matiti, kunao wengi wa mama wametolewa matiti, pia hata na wababa wametolewa matiti, tumebaki hoe hahe, rais utukumbuke. Saratani, saratani imetutesa na kutusumbua, imetunyang'anya watoto hata na wazazi, wazazi twalia watoto, watoto walia wazazi. Ewe Mwenyezi Mungu tuondolee janga hili. Sio sisi peke yetu ambao tumeadhiriwa, kunao wengi wenzetu pia wameadhirika. Wengine wametolewa vizazi wazai tena, wengine wameng'olewa macho hawaoni kamwe. Saratani, saratani imetutesa na kutusumbua, imetunyang'anya watoto hata na wazazi, wazazi walia watoto, watoto twalia wazazi. Ewe Mwenyezi Mungu tuondolee janga hili. Twapitia mengi na machungu, lakini twavumilia, hatuna wa kumwambia, twabaki vuta majonzi. Saratani, saratani imetutesa na kutusumbua, imetunyang'anya watoto pia na wazazi, wazazi walia watoto, watoto walia wazazi. Ewe Mwenyezi Mungu tuondolee janga hili.
Natamatisha shairi langu lecho nililotunga nikitumai ya kuwa rais atatusikia, atuondolee gharama, kansa itibiwe bure, nchi yetu isonge mbele. Bwana asifiwe. Nilikuwa naomba kuongelelea tu kidogo about stigma. Watu ambaye tumepitia huu ugonjwa wa saratani, tumekuwa tukidharauriwa sana. Watu wanaogopa kutukaribia. Hata ukikuta mtu kimsalimia unaona ashagundua uko na kansa, hawezi taka kutusalimia vizuri. Na nilikuwa naomba kama inawezekana serikali yetu ijaribu kutoa hamasisho kama vile zamani mambo ya ukimwi ilikuwa watu bado wanaogopa vile, sasa mpaka sasa hizi tunaogopewa. Watoe hamasisho ya kwamba sisi tukikula na nyinyi pamoja, tukikaa tukitembea nao pamoja, hakuna kansa tunaweza tukawaambukisha. Hilo ni ombi langu ambalo nilikuwa naomba, kwa sababu tunapata stigma kwa njia mingi sana. Mimi mali nilikuwa naishi, kamba zangu hazikuwa yanika mtu. Kiateka alipogundua niko na kansa, aliita watu wote kwa plot. Na nilijaribu kujificha sana. Na sasa nimejitokeza na mimi usema sitajificha tena. Nywele ndio ilifanya nikajulikana, na wakati nilingoweka hiyo nywele saa zingine nilikuwa nasahau natoka nje hivyo. Na chemotherapy yangu ya kwanza iliniletea shida sana, manake nilikuja nikadimitiwa hapo for 7 days kwa sababu ya kutapika. So wakati walikuja kunitoa kwa nyumba, juu nilioko kama leo, kesho nikawa na shida mbaya sana. Niliwaambia niko na kansa na stigma ilizidi. Ningeomba serikali yetu iweze kutusaidia upande huo. Wakenya na waomba niwaambie, Wakenya na wasihi niwaambie, kansa yambukishanwe. Wacheni kututenga, bado sisi ni binadamu, tunahitaji upendo.
Wow, 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 wow.
Bado sisi ni binadamu, tunahitaji upendo. Turudi hapo tena. Bado sisi ni binadamu, tunahitaji upendo. Hiyo ni shairi yangu ya pili, sitaisema yote. Wacha niseme tu kamoja. Wagonjwa wale wamekuwa kiona shairi zangu hapa Kenyatta, Nairobi Hospice, Thika bado mliniona. Naomba tufanye tu kamoja kenye nimezoea sana. Wagonjwa wote wa saratani topitia tabu, gharama iko juu tumeshindwa kuidumu. Wagonjwa wote wa saratani topitia tabu, gharama iko juu tumeshindwa kuidumu. Naomba rais wetu Mheshimiwa Ruto utuhurumie. Naomba rais wetu Mheshimiwa Ruto utuhurumie.
Thank you very much. We value you. Thank you so much. Unaona tuko na vipeo. Zinaitwa vipeo ama vipaji ama talanta. Tuko na vipeo, si ndio? Na vipaji. Si tunaweza endeleza. She can be an artist. You just need somebody to hold your hand. And it is good to come out. What we are saying about stigma. Amesema kuna stigma. Of another opinion. Due to us being vulnerable with our stories, the index of stigmatization has gone down. Who can agree with me? Yes. Due to us sharing our vulnerable stories, the stigma indexation has gone down. And people are seeking treatment, and people are getting to go to the hospital for screening. So please don't shy. Speak it loud. Ndio hiyo jirani yako mwingine asiogope, aondoke. Sawa sawa. Back to Benda. Thank you.
Asante sana Njeri. And wow, I must stand up and say I am in awe of you. Thank you. And also for the young lady, Hope. She's given us hope, right? Thank you so much, Hope. And thank you so much, Rachel. Let's keep using our voices and God-given talents. Now, I'm going to switch quickly. We listened earlier to an advocate who has gone through cancer. We listened to the team who are speaking advocacy from KEPCA. We've listened to the tobacco control team. We've listened to the taxation issues that we need to be addressing. Let's move over to the other side, which we are now going to be talking about policy. The reason being, it's one side to talk to the community. It's another to actually be addressed and also address the government to know what opportunities exist, what needs to be taken care of, and how is the government serving the people of Kenya. And of course, the industry that brings all these technologies and interventions that are bringing care for cancer in Kenya. And lastly, we also want to listen to the clinician, the person who faces the patient and says, we have noticed something, it is cancer. What goes on? So with great delight, I'm going to invite Dr. Ndirito. Dr. Anthony Ndirito is the consultant clinical radiation oncologist at Kenyatta National Hospital. Dr. Clinicians face a lot of patients, survivors, and caregivers daily. And we can only imagine how frustrating that must be for you to be able to tell them what we are seeing is cancer, and maybe sometimes say the treatment may cost XYZ, or the other thing that always patients say, how the news is broken down. Please tell us from a clinical perspective, what do we have currently in Kenya, in KNH and other facilities, and what can we possibly expect as Kenyans to be improved on? Thank you.
Thank you very much, and welcome here once again. Now here I'm in a different capacity. Now I'm the doctor at the Cancer Treatment Center, where we usually meet down there. To start with, when we joined the cancer space, and I think we joined around the same time with Dr. Mary there, initially we know where we started in Kenyatta. We had one machine, and that was the only machine in government facilities in the whole country. So you can imagine the situation we had then. We would see a new patient coming, you see the patient, you prescribe treatment, and then they are told they will be called. And the waiting time was 6 to 8 months to get your radiotherapy. Many of them did not make it to come for their appointment then. And you can imagine the situation we had. For those who have cervical cancer and the other, what we call the gynecological malignancies, we used to have a treatment called brachytherapy. The machine used to break down, and we would refer patients to Uganda. And a patient would stay for 2 months, 3 months before they get the money to go to Uganda. At that time, those years, the treatment was about 30,000. The patient stays for 3 months, then comes and tells you, I've got the money now. From the clinical aspect, we know that was very suboptimal treatment. And that is where we were then. A lot of the drugs that were there then, they were not accessible to patients. Even the basic drugs, a lot of them would go out of stock. And you would have to send the patient to town to go and buy. Sometimes you don't even know the quality of what they have brought. But that is what we had then. And then came in other new medicines, and we improved on the access together with the pharma industry, and they were able to bring us newer drugs and bring the costs down. And that is still improving. So fast forward, the government in the last, maybe let's say 10 years, has put a lot of efforts to improve the care that we have. From that one machine that we had in Kenyatta, the government has put some resources, and we were able to start 3 new regional centers. That is in Nakuru, Garissa, and Mombasa. Some more centers are coming, and the government is putting money in that. But look at where we are. We said, how many patients do we diagnose in 1 year? We diagnose about 40, more than 40,000 patients in a year. When we talk about radiotherapy especially, you'll find that more than 70% of them will require radiotherapy. If you're having 40,000 new patients, I told you we get about 5,000 new patients per year. If you look at the other centers, probably they'll have maybe less than that number. So you ask yourself, where are the others going? What are we talking about here? Access. They are not accessing, either geographically or not having the resources. Sometimes a patient will be somewhere in one county and they are told to come to Kenyatta. The thought of coming to Kenyatta, first of all, is very intimidating to many patients. You tell them to come to Nairobi, somebody has never been. No one in Nairobi. I'll not come. Then you come, see them, and then tell them, we are having a waiting period of 2 months. And then you tell them, we'll give you a call. The patient comes after 1 month. I've been waiting for the call. Haujafikiwa. What hope does that patient get? It is a very hopeless situation. And with the efforts that the government is making, we are saying something is being done. Something has happened over these years, but we are still behind. We still need to do more. And the people involved in that space, they are here with us, and they know. We have worked with them, so we know what efforts they are making in that direction. So we are not saying the situation is very hopeless. Initially, we were 4 oncologists in Kenyatta who could do radiotherapy, and those were the only ones before Eldoret came in, before the other centers came. And those were the ones who had to manage all these patients that you are saying. Currently, like I mentioned earlier, we have been able to start programs for training. We are now training oncologists at different levels. Those who can do radiation, those who can do chemotherapy, the gynecological oncologists. We have surgeons being trained. But if you look at the numbers, we released the first batch of the radiation oncologists, about 8 of them. At that rate of 8 in a year, that those will be able to take care of the 40,000 new patients. We will be able to take care of those who are still continuing. We are talking of survivors here. We are talking of these people come for their clinics from the day they were diagnosed. Do you think the 8 will still manage? So we are saying a lot needs to be done. Something is being done. Efforts are there. But as advocates in this space, we need to talk more, encourage the policymakers to see the need that is there. Sometimes they may not know. Sometimes you may think they are not allocating resources, but some of them have not even heard. Sometimes they will visit Kenyatta, and when they see the need, you can see the shock in their faces. Then you wonder, have they not been in the country? So you may think that the policymakers are not doing something, but some of them are not aware. So let's talk more. Let's shout so that they hear us and they know that these things are required. The other thing is, there was what I think somebody mentioned here. There is a lot of misinformation out there, and forums like this are very necessary to demystify the whole aspects of all the aspects of cancer. You'll hear people who will tell you, mimi sitaenda kupimwa kwa sababu chenye sijui will not affect me. What we usually tell people is that if the cancer is there, even if we ignore it, it is still there. What is happening is that it is growing. And if we ignore it, when it is time for it to be diagnosed, it will still come up. And by not getting tested, it does not take it away. By being tested, it does not mean that you'll get it because you've been tested. The thing is, a lot of them will refuse to go for what we call unatoa nyama kidogo ya kupima. Also hivi, it will explode. And that is a myth. Cancer needs to be diagnosed for it to be treated well. And the earlier it is diagnosed, the better. We diagnose cancer by looking at it in the lab and confirming it. There are many tests that are done to also confirm what type of cancer you have. And once that is known, we are able to target your cancer specifically with certain drugs. So it is very necessary to, if you are told you're going to have a biopsy, do it as soon as possible, but do it in a facility that you know is reputable. The NCI here has classified hospitals, and they can tell you this facility can give this kind of service, this one can give this kind of service. so that you are well diagnosed and you are treated in good time. The other myth is if it is surgery is cancer will spread. That is also not true. If the doctor advises you on the surgery, do the surgery. Others will tell you, ukipewa kimo, we umeisha. That is also not true. And I know a lot of people here will tell you that because they have gone through it, and that's why they are here to testify that. The other area that probably needs to be mentioned is in the area of diet. A lot of myths are given out there, and you end up having a patient who has been told you can't eat this, you can't eat this, you can't eat this. Get proper advice. Sometimes you also find people in white coats, maybe at a chemist or wherever, and they'll tell you need to use this supplement for this, this one for this will kill cancer. Not everyone who is there is a professional. Some of them are in business of selling those supplements. So be careful on what you are given. If you are given something and someone carry it, you tell the doctor, I was told to take this. Is it still good for me? The doctor will advise you. So in a nutshell, what I wanted to say is that the situation in Kenya used to be worse. It is still not where we want it. And that is why a forum like this is necessary, so that the policymakers can hear it, the users of these services can be able to talk, and also the care providers can also be able to articulate the challenges in getting all the patients access care. Thank you.
Thank you so much, Dr. And listening to you, some of the things you've touch on policy, touch on even access and supply of not just doctors, but also the commodities that we need. It also touches on tests for diagnosis. You've also touched on distances that patients have to travel, or even used to travel before, because right now we have a bit of decentralization of services. And so it gives me delight to actually invite the next speaker who will speak further into what capacities exist in Kenya right now and what the industry is doing to be able to bring more capacities for diagnosis as well as treatment of cancer in this country. The person is none other than Jacqueline, the general is Jacqueline, 25 years in the industry. She's a passionate advocate. She is committed to supporting initiatives that will enable us to make long-lasting and meaningful impact, such as the Empower program that is across the country, that was launched with the Kenyan First Ladies Association, as well as patient advocacy groups, some of which she may name. Thank you so much, Jackie. Just go ahead. Kindly tell us, as an industry player, Roche is one of the key actors in diagnostic, treatment, and cancers, and especially cervical and breast cancer, which of course we know are some of the leading cancers in Kenya right now, devastating Kenyans. What is available that Kenyans need to know from an perspective that Kenyans should be on as we improve access to cancer.
Thank you very much, Brenda. That's a very long question. But first, I'd just like everybody here to talk about policy. I'm also very excited. I think I see Makumi here. I see Priska here. Benda here. Over 15 years ago, we would not be standing having this celebration, because we didn't even know where the survivors were, if at all they were there. And I don't think they would fill a room like this at that time. So apart from what we are doing in Roche in terms of bringing care closer to the patient, advocacy has also been very important for us in the private sector. And it's also interesting that today we are government, we are policymakers, and we as private sector, Max Foundation, Pfizer, we are also here as part of this journey. So it is critical for us to realize we cannot do this alone. I think that's the first thing we need to realize, that each of us has a role to play within the sector. And within Roche, what we have decided to do, because of bringing So the podium is lead. We need to have some form of inclusion. So let me just use them. Let me hold it, please. Yeah, let me just hold it. Yeah, so it's not even working. Let me hold it. Can I just hold it? Yes, so even as short ones, we need some form of inclusion into this conversation. So, yes, so apart from what we are doing in the private sector, we as Roche bring in the value of treatment and diagnosis. And I think that's one of the unique things that we have in the industry, because we've been able to work together with the National Cancer Institute, the National Cancer Control Program to bring policies. And today we have HPV, DNA testing as part of the policy for cervical cancer screening. I think even for breast cancer, 10 years ago, we didn't have protocols for treatment, guidelines for treatment, and today we have that. So I think we really need to commend the government that at least we have put a foundation for us to start. And I think that's where we also come in as Roche, because Priska, you know, even when I got employed in Roche, the product that I was told to go and sell, if I had that cancer, I would not afford it. So then what was I doing really? And Priska knows that at that time, the money they were spending to get the product was actually impossible. And I think today where we are at, the National Health Insurance Fund is reimbursing the product as long as you have an NHIF cover for free. And that would not have happened without the government, without the payer, without survivors like Priska writing to the ministry every time to say she wants to be given her drug because she deserves. Then we could not say poems because we are not reached there. But we could write letters, Makumi, to the government to say we need to get treated. We used to go to the National Hospital Insurance Fund then to say we need to be treated. And that's the journey that Roche has walked together with the survivors, together with Kenco. And I think the most important thing that I stand here to say, we have to have partnerships. Dr. Nderitu has said we have come so far, but I think we can do better. Today, 8 out of 10 women who have breast cancer will not be alive in the next 5 years. We can do better. How many women are we losing to cervical cancer every day? To a disease that can be treated, you can get vaccination, and can even be prevented, but yet we are losing. I think we can do better. And what I'd like to say is that we need to collaborate. We all have different strengths. Today, SSD has brought you food. Dr. Melly is going to take you home with Uber, all of you. We have been entertained, we have danced, we have laughed, we have had what is available. What I'd like to say is that we need to stop thinking of competition. We need to remove individual objectives. We need to come and sit on this table and say, what can we do for the cancer patient? Yes. And the truth of the matter before I sit, because I don't want to say a lot, is that everyone here is a potential patient. Let us not forget that the only difference between you and the survivors and the patients here is a diagnosis. We don't know next year when we are celebrating who among us will be talking a different story. So then before you become the patient or the caregiver and you have capacity in the role you have, whether it's in the community, whether it's in the institutions, whether it's government, whether it's policy, whether it's the private sector as us, you make a voice wherever you are and make it possible for the next person, because it could be you. Thank you very much.
Asante, Jackie, and I can tell you, the passion you hear from Jackie, we've been in rooms where we've cried because the message is not getting through, but the message needs to be said. And yet, when we come and stand here, nobody sees that tears. So advocacy, advocacy, advocacy from wherever you are, so that it's not just the survivors that are advocating, it's all of us. Now we come to the part where we also get to hear from the Ministry of Health, National Cancer Control Program, because all the things we've talked about here today, all of them, is actually the work of the government. And therefore, I know our government has created a lot of capacities, and most often you will hear, as we are talking about stigma, we also talk about things that we may not know exist in this country that we could be utilizing, but because we don't know, we're not utilizing them. And so I'm calling Dr. J.P. Bor, the head of the National Cancer Control Program. Dr. J.P. is a medical doctor and a seasoned global health professional with over 19 years of experience in public health in Kenya. And she has been focused on clinical care, health system strengthening, and healthcare management. Beyond that, she specializes in non-communicable diseases, NCDs, and cancer is one of the NCDs. At implementing level, she is with the National Cancer Control Program, working on cancer policies and programs that can currently help us in the control of cancer in Kenya. She is also and has been instrumental in the development of the Cancer Control Strategy 2023 to 2027 and is currently in its execution. You heard earlier that we are now midway in that cancer control strategy implementation. Dr. JP, from a policy perspective, and I can see you have no mic, I'll bring it to you. How is the government serving Kenyans? What do we need to know? And what are the challenges that government could also call on the community, on survivors, on caregivers, on all of us to act on? Thank you. Thank you, Brenda. I am not sure whether I qualify to stand on this side of the podium or on this side, but I think it's safe to stand on this side. Allow me to acknowledge the organizers of this event. Allow me to also recognize our dignitaries and importantly, most importantly, our, shall I call them chief guests today? That is our cancer survivors, our cancer warriors. Can we give just a shout? Yes, yes. I'm truly humbled to stand before you. I don't think I've ever seen so many survivors. I've been in many cancer events because I've worked in the cancer space for the last at least 6 or so years or 7. But I've never seen so many survivors together and looking so hopeful. Thank you. I'm truly honored and humbled. And the reason, really, I just want to say you're the reason why we do what we do. And seeing you given me a lot of hope. That's given me a lot of fire in my belly to keep pushing because it is not easy what we do. Allow me also to recognize my colleagues at the National Cancer Control Program. Can you wave? Or yeah. So we are a small team. We are the cancer unit at the Ministry of Health, and we work to serve you. And in terms of the question I've been asked, what is the government doing to serve Kenyans and cancer patients? I'll begin with telling you about policy, which is really has been talked about a bit, but I want to mention that Kenya, we have a very rich and robust policy environment. We have our cancer policy, which was developed and launched in 2019, and it was in our country. And you know, cancer does not choose who it affects. It affects. Sometimes people used to say that cancer is a disease of the rich, isn't it? So that means that all of you are very rich. So it is a myth, right? So the cancer policy was developed in 2019, and it gives the direction that the country is taking and shows that cancer is a priority for our government. We implement this policy through strategies, which we are now implementing our National Cancer Control Strategy 2023 to 27. And let me just say, this is the first year
agenda of implementing it. We are not yet midway. We are on the first year of implementing this particular strategy. And we break this down into guidelines, strategies, and activities and interventions. Number of them. Allow me to mention that our strategy has 5 pillars, and the third pillar of the strategy focuses on cancer treatment, palliative care, and survivorship. So, survivors, you are at right in the middle of our strategy. Everything we do, we are trying to improve the lives, your lives, and the lives of others who will get a, get a cancer diagnosis, and we have been told it could be any of us. So, of course, you all know about the government's bottom-up economic transformation agenda. And when it comes to healthcare, the focus is on universal health coverage. And when you ask yourself, what is this UHC we keep hearing about? UHC is really about making health accessible, that is, that you can get the service, quality service. It's also about making health affordable, that yes, the service is there, but can you afford it? And lastly, it's making sure that there is equity. That means that whether you are in rural areas, urban areas, slums, or suburbs, whichever part of the country where you are able to access the health services that you require. And when it comes to this, we were supposed to be joined on the panel by someone from SHA, the Social Health Authority, but since they did not make it, and it's a government initiative, let me just mention that SHA, the Social Health Authority, has 3 funds, and the first fund is Primary Healthcare Fund. This one will fund cancer screening. You know, cancer is the whole continuum from prevention, screening, diagnosis, treatment, and survivorship. So, cancer screening will be covered in the Primary Healthcare Fund, and it's very important because when cancer is detected early, which is the focus of our strategy, we will have more people surviving cancer. We will fill many rooms with people who have survived cancer, rather than the story that we had before. So that is the first fund. The second fund is the Social Health Insurance Fund. This fund is like now the NHIF that we know. It will cover cancer patients, and I can tell you that the fund has been expanded. I know NHIF has been taking care of cancer patients, and one gap that has been there is diagnosis, right? And you know, to be a survivor, you start with diagnosis. From the point of diagnosis is when you become a cancer survivor. So it will cover diagnosis and treatment, the specialized treatment that is required for cancer. And should this not be enough to cover you, then we have the other fund, the Emergency, Critical, and Chronic Care Fund. And this fund now covers further treatment for cancer that may not have been covered in the SHIF. I hope that is good progress. And the package that is going to be, has been developed and will be soon launched, will be reviewed every 2 years or so. And we hope that, or rather we are confident that we will receive better care and achieve the UHC that we are going towards. The other thing I want to mention in policy is that as the Ministry of Health, we work with survivors. Survivors, your voices are very important. And in the technical working groups where we bring together all the stakeholders in the cancer space, in the different areas or aspects of care, we have survivors. Sydney, Lucy, those are some of your representatives. And we have others as well. And so when we are developing the policies, survivor voices are there. And even when we are implementing. The other thing I want to mention is childhood cancer. Childhood cancer is included in our strategy. Very important. And what we are working towards is improving survivorship for childhood cancer to reach where the first world countries are, which is about 80%. For us, we are at around 20%. So this is a focus for our strategy. Let me end then. The other question that Ben asked me was, what is, as government, what is our call to action to you? And I want to tell you that we all have a role to play. There are things that need to be said that I cannot say, or I can say, but when you say it, it is heard differently. Do you know that? Yes. For those of you who are married, maybe, you may have been saying something to your spouse all along, but the day somebody else says, they listen with new ears, isn't it? And they come. Go to those rooms where only you can go as a survivor, and can you advocate for financing of cancer, for early detection? You know, when somebody sees you here and they hear your story and you tell them, I was diagnosed in stage 2 and that's why I'm here, they will go for screening. They will embrace early diagnosis. That is my call to action for you. Thank you very much.
Thank you, Dr. Bor. I think at this point in time, we've heard from everybody, but we've not heard from you. And I'm pretty sure we have 1 or 2 questions that would want to be asked to this panel that we have here. So we're going to open it up, and our 2 MCs for the day are going to take the mic so that we can hear from you if you have any questions or any comment that you would want to make to this panel. Thank you.
As Sydney moves to that side, I have a question. Patient navigation. It is here in Kenyatta and doing very well when the patient is here in Kenyatta. But these people you see here are... Tuko wapi? Tafadhali mtujibu. Because if it was not for you referring her to hospital, she would not have taken the action. But the patient navigators that we have here are here in Kenyatta waiting for the patient. Watu wapewe kazi. Wanafanya kazi ya muhimu. Asante.
Asante Jerry. We'll take 2 more questions and then we can have answers. So we'll do the gentleman over here and then we can do the lady. Gentleman first and then the lady.
Okay, thank you. My name is Timothy Gitao from Stomawal, Kenya. And my question is to Dr. John Bore. After survivorship, some of us live with conditions that need supplies for the rest of our lives. What is the government doing to help us acquire quality supplies? Because we might get supplies, but they're not quality. Specifically talking about stoma bags, which we must use for the rest of our lives. Kindly comment on that.
Thank you very much. My name is Hannah. I'm a colon cancer survivor. Mine is not a question, it's a comment. I am very happy that we are in this group as a support group, and I really appreciate this initiative. But my greatest concern is, in Kenya, we tend to respond to disease. And we put a lot of emphasis on that. I really wish we could put this kind of emphasis and effort on prevention of disease. Now, the reason I say that is I have received a lot of support from this kind of initiative, but I still have, I live a very, very difficult life because as a result of the treatment of cancer, I live with nephrostomy tubes that are extremely risky to live with. I live with a stoma bag, and those conditions are very, very expensive to live with. That's a lot of money when I know a lot of other people here who are using other gadgets because they fell sick. Had we preached this gospel that do ABCD, let us eat well, let us exercise, let us avoid unhealthy weight, and so on and so forth, we will not be here. The kind of money we have spent will not have been spent, the kind of money. So I would rather support somebody to prevent rather than to as a survivor. Thank you.
So prevention is key. Kuna mmoja anataka kuuliza swali kwa Kiswahili, anaitwa Leshao. Tafadhali tumpe nafasi Leshao.
Habari zenu wote. Kwa majina anaitwa Josephine Leshao, eye cancer survivor, 13 years. Ile kitu ningependa kuuliza na imekuwa ikitusumbua sio mimi peke yangu. Pale vijijini nikirudi kwa vile Njeri alisema kuna watu wengi sana wanaumia na kansa, but wakisikia maneno ya matibabu wanaisha nguvu. Unakuta familia imewachilia, alafu hiyo mgonjwa ni mgonjwa ako na stage 2. Kwa sababu ameachiliwa anafika mpaka stage 4. Kama mimi cancer survivor mwenye alishikiliwa nikafika mahali nimefika, kuna vigeti wengine kwa vijiji, ninamsaidia aje huyo mgonjwa ndiye aweze kufika hospitali na atibiwe na yuko sawa financially?
Asante. I think let's take the questions first and then we'll come for a second round. There was a question on navigation. There was a question on navigation and patient navigation at the community level. And it also came to how we can also be able to incentivize survivors as CHPs to be able to continue offering that service as something that is paid. The second one was on commodities, and especially I've heard about the nephrectomy bags, the utilization of stoma bags as well, and what is the government doing in terms of these commodities to ensure they are good quality and they are easily accessible to patients. So I want to take the mic to our panel so that we can have, starting with the KENCO voice, as we go along with addressing these questions. Chair.
Thank you, Benda, and thank you so much for the question on navigation. This year and sometime late last year, KENCO started some 2 programs. One is training of community health workers, and another one is trying to build capacity for support groups. And the idea was so that we can be able to enhance that community navigation, which Jaria said it very clearly. That is how many people get to know about where to get care, because they get to talk to people out there. So we want to build that capacity and try to improve that capacity so that we have more people, more support groups that are able to navigate patients to hospital, and also to receive patients from hospital who are going home and help them get back to their lives. So we are doing that. As KENCO, we are also trying to structure a community navigation plan that we hope will be able to put together those ideas that we have, and hopefully find a way to fill that gap of community navigation, because the hospital is doing perfectly. But outside there, in our communities, we need something to complement what is being done in the hospital, and KENCO is already at work on that. So we'll be calling upon various partners to help us make that one even better. Thank you, Benda.
Next.
I think I can also touch on the issue of navigation and what she asked about patients who are out there not being able to access treatment. And that's what I touched on when I was talking about. Within the hospital at our center, we have navigators who navigate patients around the hospital, and that does not reach the community. I know also the cancer center where we are located currently, we are also having discussions on how do patients access the cancer center, because you know where the bus stop is, and they have to walk all the way to the other end of the hospital. That is something that the hospital is discussing about, how to get patients there. Probably Dr. Mary will get us a bus. Uber. Yes. So those are challenges that patients get when they're in the community. Those barriers to care, either geographical, finances, lack of education, and all that. And I think that is what, from the cancer control program, they are trying to address all these barriers that we have. In the area of pediatrics, although I'm not a pediatric oncologist, but we work hand in hand because they are children that we also treat. They are having a program that they are initiating where patients who are in the counties, they have a hotline that they call the pediatric oncologists here, and they are advised on the initial things that they need to do so that they are guided on what to do before they refer the patient, such that the patient, by the time the patient gets here, they are able to get timely treatment. And that is something that is being done now. And they have an on-call oncologist who is ready to receive those calls from the healthcare workers, wherever they are. And they call directly to the oncologist, and they are able to be navigated and guided for better care.
Yeah, thank you. And thank you for staying engaged and even asking questions at this point. I think, allow me to just make brief comments because this has been spoken into. You know that community health promoters are very important in our UHC plan, and our cancer curriculum for CHPs includes the part of supporting cancer survivors. And you know, survivorship starts at diagnosis. So we train the CHPs, and we are going to train more to be able to help even with patient navigation, working with stakeholders like KENCO, the National Cancer Institute, and other stakeholders to do that. I want to address Timothy's question about what are we doing to ensure access to quality rehabilitative products like colostomy bags, urostomy bags, and so forth. And I can tell you that we have made some progress, only that sometimes the progress takes long before the fruit is harvested. One of the things is that these commodities are now included in the MOH, Ministry of Health official essential commodities, essential supplies, medical supplies list. And you know, anything that is not on that list is almost not possible to stock it at KEMSA. So those commodities are now in the essential medical supplies list, which was launched either towards the end of last year or early this year. And so we will be working with KEMSA to ensure that they stock those commodities so that cancer survivors, cancer patients can access them at the county facilities. I think that will help the journey. Yeah, I think
we have been notified that our time is really running short. And so I want to give the other panelists who have also not spoken a moment to also put one word or one sentence that you would want the survivors to be aware of as we are coming to the close of the panel. Over to you. Yes.
Let me begin by saying I want to thank KENCO and NCI. They gave me a privilege to speak to some MCAs in Naivasha. And I remember, this is something you'll all know, that when you get the diagnosis of cancer, you get too many doctors, too many pastors. It is very important. From what you've seen today, what I've heard from all the panelists here, this is the best support. I remember I was told to go to a certain pastor, he prays for people, and so on. But I said earlier, and I want to re-emphasize, listen closely to the medics. They have the information. If you think you're doubting, thank God, Mr. or Mrs. Google is available. You can always check and counter-check. Otherwise, you may end up landing in trouble. So, and that's why I say again, I'm here. Because I want to touch one more thing, because Salome who talked about stigma. You will face stigma, but where are you? Where do you want to go? My last statement is, I remember a colleague who came to me, and she said she actually saw me when I had lost 50 kilos, and she ignored me. And she went to the office to ask what happened to Uncle Zach. And she was told, Uncle Zach has cancer. But she gave me the reason she ignored me because she thought I had HIV. But she came to me personally and told me I went through this. So you will go through that, but get people who will give you encouragement. With due respect to all religions, the book of Hebrews says, encourage one another daily. daily. Not some days, it says daily. Thank you, guys.
Thank you. I think I don't want to speak so much on policy and the budget things anymore. To just also mention that I think our walks are different in life. As we are having cancer survivors, I like to say I'm a mental health survivor, so to speak. I think 7 years ago, I had to check myself into Madari Mental because I now knew mental health and, as you say, self-awareness. But, and when I hear Daktari talking about early diagnosis, for me was, I felt I was unwell, but I kept talking to my husband. I'm not feeling well. I think I'm going out of my mind. He tells me, but we get people who've gone out of their mind on the streets. They don't self-diagnose. But I didn't even listen to my husband. I took myself in, and I'm happy that just accepting what it was. And I think I've been 7 years. I thank God I'm still taking care of my kids. So just to encourage us that we might be thinking you are a cancer survivor, but everyone has their own issues they're dealing with. And ours is just to encourage each other. And I look forward really to engaging more. Thank you.
And as KEPCA, we are grateful for the opportunity. I would wish to say that palliative care is a right to health. And we all, we would wish that all of you have access to these services. You can find the hospices and palliative care units that are near you on our website. Kindly ask for help where you need. Palliative care enhances hope, dignity, and resilience. And for us, we have seen that our survivors, I can talk, I look at and I see Susan, who has been one of our champions. And honestly, for us, survivors have walked, and people who have walked in the journey of palliative care, they have been our greatest navigators and the ones who offer hope to people within our communities. So encourage all of us to ask for help where you need it, and together we will, as NCI says, that together we can stop cancer. Thank you.
Thank you once again. I should say that, as it is said, you are your best run doctor. So you take care of your mind, you take care of your body, take care of your nutrition, all those kind of things. And develop a thick skin. Don't be a crybaby thinking that somebody will sympathize. People don't sympathize with the others. In fact, they say survival of the fittest. So if you are not fit, you are swept aside. So you must just be strong-willed and move on. And say, as somebody says, nitainua macho nitazame milima, msaada wangu unatoka juu. So that anybody else who wishes you maybe bad finds you still going strong and strong, the way my brother says here. And they marvel. We have always said, you keep thinking that so-and-so is so sick, you are going to bury them, and then the same fellows bury you. Because when you thought that you are the one going to bury them. So be strong, continue supporting each other, and we are together in this, and God bless you.
So it is my delight to thank our panelists for the time that we've spent here today. We've talked a lot. We've picked a lot of things that we can take back to the community and be able to educate. And also to thank Kenko for this invitation. As I'm closing this panel, I have just one message. Survivorship is going to be the link to the community for prevention. Let me tell you how. Jerry said that I am Mama Mlima. Yes, you cannot believe that I've climbed mountains with this body, and the survivors themselves have come with us. But the one thing that has happened, even as we climbed mountains and we came down, was that I've seen a mindset change, I've seen a physical change, and I've seen a resilience with the survivors that I can only speak about loudly to say kudos to all of you. Right now, amongst you, there are Kilelians who have been trained on mental wellness, not just so that they can be themselves taken care of as counselors, but they have become counselors themselves. Ebu Kilelians, stand up. The ones who are here as the counselors, just stand up. I think Joanne, yes. We have 1, 2. There are a number of them, even the ones who have walked out. There are 13 of them. And all of them are giving this service for free to the survivors. Why? Because we recognize charity begins at home. And if the survivors have gone through the journey and they've been given resilience, they are also going to be the ones who are giving that resilience to other people. And therefore, I would encourage you, as she said, mental wellness. Let's not stigmatize that. Don't go thinking that because you're a survivor, that you need to talk to somebody because you're going through a hard, difficult situation, that it is a weakness. It's actually a sign of strength. Be strong in the phase that you are in, and take it as a lesson so that we can take the lessons to other people. Survivorship matters, mental wellness matters, physical fitness matters, and to the government of Kenya, thank you that you've now come to the table for all of us to be able to dialogue. The survivors, thank you for your time, and thank you to all who have put this together. Asanteni sana. I will hand over to the MC for the next chapter. Thank you. Asanteni.
There is a gift for you mkitoka hapo. Survivors wachache, kujeni mpeane hizi vipeo. Kujeni mpee hawa watu hizi vipeo. If you're a survivor, come and gift. Yes. Kujeni mpeane hizi vipeo kwa kila mtu. Asanti. Oh, ni vipawa. Oh, asanti. We want to appreciate you. Thank you very much. Peana hapo. Bado naendelea kusema tunaenda nyumbani na Uber. Mimi nilikuja na matatu narudi na Uber. Nani anasikia mariko kama mimi? I need to be celebrated every day. Daktari, I want this to be an everyday event so that I can be Ubernating. And thank you for the media coverage. Who is feeling good like me? Yes, tunarudi na Uber. Hakuna vumbi na nduthi. Na sio Uber baridi, mpande hiyo Uber. Sawa sawa. Thank you so much to our panelists. Thank you for the healthy discussion. Thank you for airing your concerns. One person asked me there that mtoto wake alitibiwa kansa na akapona, lakini waliachiliwa. Hawa watu wanaendanga wapi? There are so many questions. I think the best thing is to write them down. Please get a piece of paper. They'll be addressed. They'll be addressed. So write your questions down if you didn't get the moment to ask because of time. Then we are going to collect. And then we'll give them to them. Na simulisema hamzimangi simu? Kwa hivyo mtajibu. And we'll give you the response. Sawa sawa? Thank you. Sydney?
Thank you very much for that wonderful discussion. We are moving towards the end of our program. And at this juncture, I just want to recognize the National Cancer Institute and Dr. Meli for your efforts. Without NCI, we wouldn't be here today. They have ensured that this has streamed live throughout the country so that all the survivors who are not able to make it here today can actually watch and listen to the discussions we are having. They have also been able to ensure that the survivors who wanted to come can come here and go back home without worrying about where am I going to get money for fare. NCI has always had an open door policy as long as I've been in the cancer space. If you want to look for Dr. Meli, he doesn't hide his number from you. He gives you his number, he'll WhatsApp you, he'll respond. So we appreciate you, Dr. Meli, and we appreciate what the National Cancer Institute is doing in the fight against cancer. So at this point, I want to just give a brief introduction to our chief guest, Dr. Elias Meli, the CEO of the National Cancer Institute. He's a medical doctor and a cancer expert. He's the current CEO of the National Cancer Institute. Dr. Meli is highly skilled and knowledgeable with experience at the local, regional, and global levels in clinical care, training, research, program development, and growth. He believes in value-based transformative leadership and governance. Dr. Meli is gifted in building partnerships and collaborations. He's a true advocate of service to humanity without fear or favor. So Dr. Meli, I invite you to the podium to come and address the guests. Give him a clap, please.
Tunasema asante, tunasema tunasema ewe Mungu wangu, wewe ni Alfa na Omega, wewe ni Alfa na Omega, wewe ni Alfa na Omega, ewe Mungu wangu. Well, we are here to celebrate, right? And celebration involves a lot of singing and dancing. I came in and the survivors were really dancing here. So I know that we are almost at the climax of this festival, this celebration. Mine is going to be a very brief talk to us. First of all, allow me to thank God for every one of us who are here alive today. And most importantly, our survivors. Niongee Kiswahili ama Kiingereza? Swahili, si ndio? Yes. Mimi nimeona hapo nika-realize with my little high index of suspicion, nikaamua kuwa I am told I need to be here. So in the interest of inclusivity nitaongea kwa Kiswahili. So ningependa kuwashukuru ninyi nyote siku ya leo kwa nafasi hii. Kwanza kushukuru Mwenyezi Mungu, niwashukuru wale wote ambao wamepitia matibabu ya saratani katika nchi hii na nchi zingine, na pia nishukuru viongozi wetu kutoka vitengo mbalimbali hapa. Ningependa kushukuru wale washikadau, all the stakeholders who are involved in cancer space. Mimi nikiwa daktari ambaye anapigana na hili janga la saratani pamoja na madaktari wenzangu, Dr. Nderitu yuko hapa, on behalf ya madaktari wote katika nchi hii, wale tunawaita front line officers. Na si madaktari tu, bali wale wote ambao wanahusika, hata wauguzi, wale counselors, social workers, wale ambao wanaweza pia kugundua, pathologists, laboratory specialists. Mimi ningependa kushukuru Mwenyezi Mungu siku hii ya leo. Kila wakati mimi hupenda kuanza maongeo yangu kupitia hadithi ambayo ni zile shida wagonjwa wanapitia klinikini. Tumepata nafasi kuweza kuhusika katika matibabu. Na ninajua wale ambao siku ya kwanza wakielezwa kuwa umejulikana kuwa na ugonjwa wa saratani, machozi ni mengi. Wangapi walilia hiyo siku ya kwanza? Leo ningependa tulie machozi ya nini? Ya furaha. Na leo sitaongea sana kuhusu wakati ule, bali tuweze kuongea kuhusu sherehe tulio nayo leo hii tukishukuru Mwenyezi Mungu, si ndio? Na ningependa pia kusema asante kwa sababu ya nyinyi ambao mumehusika katika kupigana ili uwezekano ya kutibu ugonjwa huu ukue katika nchi yetu. Cancer advocates, tukiongezwa na chairman wetu na executive director wa Kenco pamoja na board ya Kenco na wale CSOs wote. Leo ninasema with confidence kuwa kama nyinyi amungehusika wakati huu, probably hatungekuwa mahali tulipo, because nyinyi ndio mnajua mahali kuna uchungu zaidi, si ndio? You know where the rubber meets the road. And therefore, when you stood firm and spoke in loud voices, I always say I cannot talk about cancer journey and successes without mentioning the civil society, without mentioning the cancer experts who more than a decade ago with a lot of passion, they faced the leadership in this country and asked that we should speak a different language. We should have a different conversation. We should make sure that we address this problem with the seriousness that it deserves. Ni wakati hule mulisimama mukashika mabango vile mmetembea leo in our streets, wakati hule na serikali ikasikiza kupitia kwa Wizara ya Afya. Hiyo ndio wakati serikali ilijitolea ikahakikisha kuwa lazima tuweke resources ili tuweze kuaddress this problem with the seriousness it deserves. Hiyo ndio sababu ulisikia Daktari Nderitu akitueleza kuwa miaka 10 na sasa hivi kuna tofauti mwingi. And I will tell you with also confidence, even internationally, regionally, we are a star country. We have made so much progress. Our stakeholders who are in the industry, Ms. Jackie Wambua will tell you, Roche spans across Africa and across the globe. Likewise to Pfizer, AstraZeneca, all those who are playing in that space. There is so much investment in our country right now. I was in a meeting recently, and we were ranked with Egypt, South Africa, Morocco, and Algeria as the leading tier in cancer care in this region. So ningependa kusema you are lucky, even if we still have a few challenges. Ningependa tuweze kushukuru yale serikali imefanya kupitia Wizara ya Afya, kupitia the National Cancer Institute of Kenya, ambayo ilizinduliwa zaidi ya miaka 10 zilizopita ili iweze kuhusika na kupigana na hii janga one by one. Na ningependa kusema hivi, sasa tuko na uwezo afadhali, hata ingeweza tungependa tuweze kuwa na uwezo zaidi. But what we are able to do right now, one thing that I encourage my team, and speaking from a strategic position, we need to tighten the quality aspect of care. So that even as we move forward to continue providing care, what we really want to interest our people is even that care that we provide, let it be quality. So that we can have many people who are surviving. So that we can have many people who, if we don't provide that care across the continuum, they should not fall on the way. And as I speak to that point, shall we observe a minute of silence for our colleagues, our fellow patients who may fell off before today. Thank you. We loved them, and they had hope that they will live to the fullest of their time. But because of challenges that may have been inevitable, haikuwezekana. So tunashukuru Mwenyezi Mungu. From the National Cancer Institute of Kenya, we endeavor to work with you this journey. I remember when I assumed office, I called all the civil society organizations, and I said, let's have a conversation. We have been delegated this responsibility, and we have to work together. We have to work with the civil society. We have to work with all the partners, government and non-governmental. We have to work with private sector. We have to work with patients. And I promise to you that I cannot do, or NCI cannot do what you are doing. But with your strengths and the strengths and capacity within the National Cancer Institute of Kenya, we should win this battle together. How are we going to do that? I want to appreciate all the panelists who are here this afternoon. That was quite an engaging, and I can actually tell that we are speaking the same language. We are addressing this problem from different corners, looking at it across the entire continuum of care. Tunafanya hima na bidii, kila mtu amejitolea, na hilo ndilo wito wetu hapa leo kuwa tuweze kufanya hima pamoja. Ningependa hata kushukuru our religious organization. I want to thank the leadership at the temple which our brother is from that have blessed us with lunch this afternoon for our survivors. It means we are one family and we are going to win this battle together. We want to make sure, a lot of us have talked about prevention. It is true, and it is the mood of this current government that we put more focus on prevention. My role at the National Cancer Institute of Kenya is to look for resources towards cancer space. When you hear Dr. Meli has supported us for Uber, you have actually used your resources to facilitate your own services, and that is how we should use taxpayers' money. Ama namna gani? Let our resources be able to address where the biggest problem is. And we are going to put all the efforts to make sure that there is a countrywide HPV vaccination. We have low-hanging fruits. Cervical cancer should not kill any lady, any woman, whether young or old, in our country. Other countries have done very well, and we are able to work with them closely to know what is the secret. Australian government is the first one leading to eliminate cervical cancer. We have targets. 2030, we have been given targets by WHO, which we are signatory to. And being a signatory, there are many initiatives towards cancer care ambayo sisi lazima tuhakikishe tumeweza kuifikia. I also want to mention to you with confidence that cancer is a bit complicated, and it also takes personal responsibility. My work and my team and all of us is to communicate what you need to do. When you talk about early detection can only happen if we undergo screening. We have communicated. Therefore, I am calling all of us, survivors, and those who are watching, viewing, listening to us this afternoon. It is your responsibility to be screened for cancer. And we will sing this day and night. Breast cancer, prostate cancer, cervical cancer, cancer of the esophagus, colorectal cancer. We have modalities that we can use to make sure that we screen you, and some of them are very cheap. You know, a lot of time we talk about cost, but there are some screening modalities that cost 0 shillings, especially where there is capacity in our institutions. We have done a lot to make sure that our county governments have capacity in primary health care, beginning with enhancing capacities with a lot of partnerships. Let me single out the Empower Clinics and the First Ladies Forum for initiating this idea. And I've mentioned a lot of times to Her Excellency Dorothy Nyong'o, who with her family have been true champions and advocates of cancer space. Can we clap for them, please? When I was going for my postgraduate training, I shared with Madam Dorothy recently that I went to Africa Cancer Foundation and asked for funding because government was not able to fund my foreign training because they had become the light then. Fortunately, government heed my request and they funded my training outside this country. And right now, we are happy that we have capacity to train locally as we are building that capacity. Allow me to also, ladies and gentlemen, mention that the sacrifices that you've made as survivors is a true embodiment of hope for us. so that even as we invest resources, we know there is value. We know there are results. Any investor, when we are resource mobilizing, people ask for value. And I think the value is what we are seeing here today. The value is those of you who braved all the side effects, those of you who went through mutilating treatments, whether surgery or radiation, those of you who vomited, those of you who lost your hair, those of you who have complications that are lifetime. We celebrate you. We shall support you. We shall walk with you this journey to the end, and we will make it comfortable for you. I think that is the hope that we need to have today. And as we work towards winning this battle, I have mentioned again and again that we have so many mushrooming cancer centers across the country. And one of our roles is to provide standards and quality. We shall help you from a government perspective to make sure that when you go to a center, truly they have capacity across the continuum of care, so that you do not get the wrong surgery for the wrong diagnosis. Has it happened before? So that you are not treated for breast cancer and later on you are told you didn't have cancer. Yet you have suffered a lot. It is our responsibility to make sure these institutions are established, they are running, and they are providing quality care for you. We also want to invite you as patients, and it is a global call right now that thou shalt not do anything unless patients are involved. And that is why we are having this discussion today, and we shall continue having it. I recently had a recruitment process at the National Cancer Institute of Kenya, and I insisted that we cannot have a staff which the patients themselves are not part of. And we were able to recruit some of you to be part of establishment at the National Cancer Institute of Kenya. They will share with us real experiences. They know the challenge they went through. We are also struggling with understanding ourselves. Do you know why sometimes you get treated and you probably get more side effects, and you wonder why me and someone else did not get that much side effects? We still are working towards understanding ourselves. And we have now committed resources into research. We are going to win this battle if we are a research-oriented country. And this research, patients should be part of this. Chairman Kenko, I want to ask that any research proposal that we are writing, and we are going to ask our research scientists, because you cannot conduct research as an individual, we should have patient voices. Last year, we had a research meeting in Mombasa, and I wrote to Kenko and I asked, we would like to sponsor 2 people from Kenko to be part of a workshop. And we had representation from Kenko. We are moving forward with that journey, because for sure, you have to be on the table when discussions are being undertaken. I also want to encourage you that we will be your true advocates to make sure you get quality medicine. We would like, even as we struggle towards survivorship, we want you to survive when you are not cursing that I better have died than to suffer complications that are more stressful than when you are alive. Are there some of us who've ever wondered whether that could be an option? Because people go through a lot of challenges. If you hear Uncle Zach mention that he lost family, so if you've lost family, I don't want to ask, But what I know is it has not been easy for him. But let's be his family. That's what I told him last time. And those who have joined him as we move forward. Because we have to work together, we have to encourage one another. We will work towards making sure you can access, for those who are going through treatment. I want to encourage Rachel and the team who have come out loudly. And I want to commit that I will do my best to get you to meet the president. I will use the networks that I have to make sure that happens. Because our president is accessible. Haven't you seen every time when he's meeting people in State House? And I know he would be willing to listen to you so that you can tell him what you're going through. All right? So I will work to keep my commitment and communicate through Kenco leadership. I listen to Hope giving us hope. And I see this young girl, and I see hope. I see the future. Dr. Nderitu, I think this young girl should be an oncologist in future. She should be hanging around Kenyatta Cancer Treatment Center, doing advocacy and encouraging people with poems and songs, right? And we need more of such people. If all of us could do this in the premises where we find ourselves, then I am very certain we will win this battle sooner than we thought. I want to end by asking all of us, whether you've gone through the experience or not, the fact that we are here, then it means we have all committed, we've all sacrificed to stand for each other. We have all created time. We are all using our personal and institutional resources to make sure that we win this battle. Many a times, you have asked that cancer should be declared a national disaster. Many a times, we have asked for practical prevention through regulations. And I want to echo the Ketka and team and Irene at the Taxpayers Association. We have engaged the National Assembly on legislation towards practical cancer prevention, and it is work in progress. In fact, as we speak, we are working with the legal team at the Department of Health National Assembly to craft these legislations to be sponsored by one of the members of the committee. So as you go to the parliament this afternoon, just know we are all together in this. We are all going to make sure that out of the 44,000 patients who are being diagnosed with cancer every year, if they must increase in the short term, it is because of increased diagnosis. But in the long term, the curve should come down. Down, 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 and down. And if one has to be diagnosed, because 70% of those are diagnosed with stage 3, 4 cancer, then let it be stage 1, 2, because of prevention and early diagnosis through screening, who, when they are treated, they will all be surviving, like yourself, this afternoon. That is our wish, and that is our prayer. So I want to, with confidence, again, give you, as survivors, as stakeholders, as partners, those who treat, those who support any of the 5 pillars in our National Cancer Control Strategy, because we are all involved in that we shall work together. And I want to encourage you to work very closely with the National Cancer Institute of Kenya, because we are your voice. There are many things that we do in our communities, but sometimes nobody gets to record and report so that you can also be acknowledged to be an award-winning. How many of us wants to be award-winning? You know, Benda Kilele, congratulations, and Mwalimu as well. I'm sure many of us, their work should be seen, and you should be seen to be making that difference. We will be able to acknowledge and report jointly. The reason why the National Cancer Institute of Kenya was established was to coordinate. So let us coordinate. Let us know how you want to help and how we can help you. As you've heard, our offices are very open, and we are willing to support when we have capacity. Allow me then to wish you a very good afternoon and provide commitment that we are leading in the cancer response, and together we shall win this battle against cancer. May God bless you. Thank you.
Thank you very much, Dr. Meli. We have heard all you have said, and we will hold you to it. We'll be camping at your office so that you can take us to State House. I think Dr. Meli mentioned the work that Madam Dorothy Nyong'o has been doing, with the governor of Kisumu. And I think it would not be fair to end this meeting without giving her a chance to speak about survivorship and the work that they are doing in Kisumu and throughout Kenya. So allow me to introduce Her Excellency, the First Lady of Kisumu County, Mrs. Dorothy Nyong'o. She's the Managing Trustee of the Africa Cancer Foundation, a charitable trust headquartered in Nairobi, Kenya. The ACF works towards a cancer-free Africa by creating awareness on cancer, partnering with corporates, like-minded non-profit organizations, and medical institutions in providing cancer information and free screening services for breast, cervical, and prostate cancer for the general public. Spearheading cancer research and guidelines, as well as advocating for governments to pay due attention to cancer and to increase the preventive, diagnostic, and treatment services for cancer on the continent. She's one of the people who I know who has a very big heart, and when she says she's going to do something, she does it from here. Her door is also very open. She has opened so many doors for all of us in the civil society space. So without much ado, karibu sana.
Thank you so much, Sydney. CEO, NCI, CEO, on behalf of the CEO of Kenyatta National Hospital. You want me there? Partners, all the partners, ladies and gentlemen, survivors. Wow. This is such a special day. Well done, Kenko. As has been mentioned before, 10, 12 years ago, we couldn't even dream of such a gathering. So this has been a very amazing occasion. And I want to thank God for this day. I also take this opportunity to salute my husband, Governor Anyang' Nyong'o of Kisumu. So I'm here as a caregiver. I'm not a survivor, but I have walked the journey with all of you. So I understand. I understand what you have gone through and what you go through. I'm not in your shoes, but I understand. So I salute Governor Nyong'o because you've heard of all the milestones that have taken place in this country over the last 10 to 12 years. And I would attribute a lot of it, the open space to my husband, because at a time when he was the Minister for Medical Services, at a time when you never ever heard of a leader having cancer, at a time when men did not talk about these things, and as you've seen today, they are still shy, he came out and spoke, he wrote, and a movement began. And people started going in for screening, and men who would not otherwise have gone in for screening did. And the space was opened. The space was opened up. Government started paying attention. Policies started being written. And we can say the rest is history. So I salute all of you. I thank God for the journey that you have all undertaken. I'm very, very proud to be associated with KENCO and with all the partners. Some of the partners I've worked very closely with. Thank you, Roche. The Empower Clinics would not have happened without your support. And so I will not be repeating what everybody has said. What needed to be said has been said. We cannot walk this journey alone. We have to partner. And let's continue to partner, and let's give hope a chance. That's the call that I will leave with you this afternoon, and may God bless each one of you.
Thank you very much. I think she deserves a better clap. I am told that there's a special message that was sent here. And to read that special message, I'm going to invite Dr. Bor, the head of the National Cancer Control Program, to give us the message that was sent. Celebrating life, embracing hope. That's why we're here. I know we're hungry. I know we've been here a long time. We are almost done. And we are also going to have some cake cutting, so maybe you can get excited just a little bit. Dr. Bor, karibu sana.
So I am here to read a speech from the Cabinet Secretary for Health, who had been invited as the chief guest for this event. But as many of you know, this week there was a very important global event happening. How many know? There was the World Health Assembly, and our CS was attending that very important meeting and making big wins for our country. And I was requested to be here on her behalf and to read her speech. So without any further ado, I'll do exactly that. Your Excellency, Madam Dorothy Nyong'o, Mama Kisumu. She's hearing. The CEO of the National Cancer Institute, Dr. Elias Meli, cancer survivors and patient support groups represented here, caregivers, the Kenyatta National Hospital Management, civil society organizations led by KENCO, partners in cancer prevention and control, including private sector. We have seen Roche, we have seen Pfizer and others, health workers, members of the press, ladies and gentlemen. Today I'm honored to join you in the first ever Cancer Survivors Festival under the theme Celebrating Life, Embracing Hope. First and foremost, allow me
to salute all the cancer survivors gathered here and even those who are not here. Ladies and gentlemen, cancer survivorship is anchored in the National Cancer Control Strategy 2023 to 2027 under the third pillar, whose goal is to ensure timely access to comprehensive cancer treatment and improve the quality of life of all cancer patients. Improving cancer survivorship starts with cancer prevention, screening, early diagnosis, and effective treatment. Almost half of the new cancers reported every year in Kenya are preventable, including the top leading cancers, which are breast and cervical cancer in women, and prostate and esophageal cancer in men. Our vision as a ministry is a nation free of the preventable burden of cancer, and we are implementing various strategies to this end. In order to put our country on the path to eliminating cervical cancer by 2030, as per the WHO Global Strategy for Elimination of Cervical Cancer, we are working to scale up cervical cancer screening services. In the past few years, more than 12,000 primary health workers have been trained on screening and treatment of cervical cancer in all the 47 counties, and about 1,000 cervical pre-cancer treatment devices have been distributed to county facilities with the support of various partners. We are also implementing the Global Breast Cancer Initiative, which aims to avert 2.5 million deaths globally by 2040 through health promotion, early diagnosis, and comprehensive treatment. Another major initiative that we are implementing is the Global Initiative on Childhood Cancer, which aims to improve childhood cancer survival rate to 60%, especially in low and middle income countries such as our own. We know this is possible through proper awareness creation on childhood cancer early warning signs and access to comprehensive cancer treatment. Fellow Kenyans, as we commemorate the National Cancer Survivors Day today, we take the opportunity to connect with and celebrate people living with a history of cancer, and also to recognize those who have supported them along the way. To any patient who has just received their test results or has recently received them, for any patient who has just begun their treatment, whether it be chemotherapy, radiotherapy, or other treatment, for any patient who is scheduled for a mastectomy or other surgery, and even to the patient who has been declared cancer-free for 1 year, for 5 years, for 10 years, or even for 30 years, we salute you today. We may never truly understand the journey of every survivor, but we truly salute you for your bravery and for your resilience. Indeed, we have a reason to celebrate life and embrace hope, and this is because of all these cancer survivors among us here today who have faced this disease and who have faced this disease that many believe to be a death sentence and have come out victorious. We acknowledge that surviving cancer is not a walk in the park. It is associated with a number of challenges, physical, emotional, financial, and so on, and we have heard about these challenges today. And these challenges may persist for years after diagnosis and treatment. On this day, as we celebrate cancer survivors,